I invite Dr. Yasin as a panelist, Dr. Meghendranath, Dr. Umi Bairamji. Please come on the dais. Dr. Saman.
Modern medicine, we all know that it do help in those conditions, in emergency conditions. Now, what acupuncturists can do? We'll have a discussion about it. We have got a neurosurgeon also with us, what they can do and what we can do in combination or individually also. So, consultation in stroke. Acupuncture is not the first consultation called for in these urgent cases. To determine the most appropriate treatment for the stroke, there should be an emergency team that can handle emergency cases and also evaluate the type of stroke with proper diagnosis. I think on that, Dr. Yanish can talk a little bit about it. What are the conditions in stroke and how they handle? Please.
Okay, so stroke is basically of two types. One in which the blood vessel gets blocked, that's the ischemic stroke. And the second is when the blood vessel bursts open and the blood spills over inside the brain, and that's the hemorrhagic stroke. There's no way to diagnose it clinically, whether the patient has ischemic stroke or hemorrhagic stroke. So if the patient has high blood, the common reasons why people have stroke is high blood pressure, high blood sugar, and the comorbidities such as type A personality, drinking habits, and obesity. So these are the common reasons why people have stroke. For a patient who has these risk factors is more likely to have ischemic stroke. For patients who have only high blood pressure as a risk factor, they are likely to have hemorrhagic stroke. But then either patient can have each thing. So the stroke, how do we know the patient has stroke? The simple way to understand the clinical chemistry of stroke is any patient who has either hemiparesis or monoparesis, weakness of either arm or leg or face or a combination of these. So any patient who has sudden onset of weakness of one side of the body has stroke and needs further evaluation. So what evaluation we will do? The first evaluation depends on which place in India you are. If you have quick access to an MRI of the brain, then MRI is the gold standard. However, if you don't have an access to MRI, then CT scan is adequate enough. So I think the further discussion will be by Dr. Verma.
So I want to know, Dr. Yanish, what are I've said the type of strokes you have discussed. What is the proper diagnosis? Like what you will go for? Like any lab values or any benchmark to find and do something on that?
Okay. So the first thing for any stroke patient is as soon as the patient enters the emergency department, you need to know his blood pressure, to his blood sugar, the coagulation profile, bleeding time, clotting time, and prothrombin time index. You need to do a CT scan if the MRI is not available. If the MRI is available, then the MRI is the gold standard, which includes diffusion sequence. That's one of the sequence in which you can diagnose brain stroke very quickly. Within half an hour of the onset of symptoms, you can have bright images on the MRI which can conclusively prove that this stroke is either ischemic or hemorrhagic. The other imaging modalities which are required sometimes are a cerebral angiogram, because the stroke can also be because of an aneurysm which is due to weakness in an artery of the brain. And so in this case, this is a digital subtraction angiogram of the brain in which you can see an aneurysm arising from the internal carotid artery. The other investigations like carotid ultrasound and echocardiograph follow these primary investigations, which include blood test, MRI or a CT scan, and MRI or a CT scan. So these are the first investigations which need to be done in any primary stroke center, which is inclined to treat stroke patients.
Good. That's true. So, what is the clinical practice? Can acupuncture really benefit stroke patients? Many people have asked this question. Our answer is definitely yes. But recent Western research and meta-analysis make the claim that there is no clear evidence for the additional value of acupuncture for post-stroke rehabilitation. So I will ask Dr. Saman, what is the discrepancy?
As far as the acute condition is concerned, we have a set of points called Ziegler points in acupuncture, where we can use to treat for acute conditions. So when we go to the traditional Chinese medicines, we have 8 specific tissues like cardiovascular system, respiratory tract system. In those systems, there is a particular point where we can use for acute conditions of that particular specific tissue. So those points are called Ziegler points. The Ziegler points are used to treat for acute conditions of that particular internal organ, acute condition of the channel, carpal channel, connected tissue, connected sense organ. So the chronic cases, we can use acupuncture points. Specifically, motor points can be used to enhance the functions of muscles, which has been already weakened by the stroke, along with the rehabilitation programs.
Great. Thank you. So actually both the statements are valid. Now we are much clear that acupuncture also do help in those conditions, and we can even help in acute conditions. Like for example, I have treated many stroke conditions in my clinic. Acute conditions also. I have even treated cardiac arrest also. It is possible, but I have sent them immediately to the hospital. I don't take that I will take care of them everything. So it's always better. You know the points, what he said, emergency points. Other than that, you can do acupressure also. You can needle the lung leaven also. You can bleed that in heart condition. I've treated like that many cases in our thing. And because it is hardly brain stroke, it takes only 1 to 2 minutes. And if it's in cardiac arrest, you got some time. But if the oxygen is not reaching to the brain, it starts damaging faster. It may be even 1 to 2 minutes. So we have to have some technique like acupressure, acupuncture, where we can help that patient to go to the hospital, because we are not trained for cardiopulmonary resuscitation. Am I right? We are not trained as an acupuncturist. So for that, what we are trained? We are trained for the acupressure points or acupuncture points. I think if it is a brain stroke, we can't do acupuncture for a minute and relief from the pain. It's true? So as he discussed, these are the 2 stroke conditions, and these are the treatment, warfarin and aspirin. And Dr. Anish can even highlight more on this, please.
So as I told that the stroke is of 2 types. One is ischemic stroke and one is hemorrhagic stroke. So hemorrhagic stroke is the one where the blood vessel has bursted open. You would like the blood to be thicker, and you don't want the bleeding to continue inside the brain. So you want to give medicines which make the blood even thicker and accelerate the clotting, so that more blood does not leak inside the brain. For an ischemic stroke where the blood vessel has blocked, you need to make the blood thinner so that the clot inside the blood vessel opens up. And for that, you either give patients aspirin or heparin or a combination of both. Or if the patient is within the time window of first 6 hours, then you can give thromboplastin. That's called the TPA, tissue thromboplastin activator. If that doesn't work, then you can go inside using a catheter and pull out the clot from within the blood vessel of the brain. So this is the treatment regime which we follow. So as soon as the patient comes, we do an MRI, determine what kind of stroke it is. If it is a ischemic stroke, we make the blood thinner. If it is hemorrhagic stroke, we make sure that the blood is thicker. A word of caution about blood pressure. When you have stroke, you do not bring the blood pressure down very quickly because the brain has over weeks to months adapted to this kind of blood pressure. So whatever you do, you need to bring the blood pressure little bit down so that the brain perfusion does not suffer. Because if it is an ischemic stroke, you bring the blood pressure down, the already narrowed blood vessel which is feeding the brain will have lesser pressure gradient, and the blood pressure and the blood flow to the brain will reduce. If it is hemorrhagic stroke, if you don't bring the blood pressure down very quickly, because the brain around the hemorrhage is also being perfused by the same blood pressure.
Can we use any surgical interventions for that to prevent stroke?
Yes, there are many surgeries which can be done before the stroke happens. So we need to know why stroke has happened. If it is an ischemic stroke, that means the clot is inside the brain blood vessel, inside the blood vessel of the brain. So from where does this clot arise? This clot arises either from the heart. So a clot has formed inside the heart because of atrial fibrillation or abnormal pulsation of the heart, and a piece of that clot has traveled from the heart into the brain. Or the clot has started from a blood vessel which is supplying the brain. That's the carotid artery. Sometimes the carotid artery has an ulcer, or it has a plaque which ruptures, and this clot travels from the carotid artery inside the brain. So then I come next to the carotid reasons of brain stroke. If any person who has a narrowing of carotid arteries which supply the brain, then you can do either a carotid stenting, or you can do a carotid endarterectomy. Endarterectomy means you clamp the artery on both the sides, and then you open up, clean the blood vessel, and then close it back to restore the flow to the brain. So any narrowed blood vessel which supplies the brain can be opened either by surgery or by a stent. This is similar to the cardiac stent which we put for narrowed cardiac arteries.
Thank you. So now what an acupuncturist can do in these cases, can I ask Dr. Ganthait, in ischemic and the other stroke conditions? What can we do, sir, if there is any? We have got results in the post-stroke conditions, but maybe both in acute conditions and post conditions, what we can do to the patient, how can we help them? And what are the points?
In post-stroke conditions, definitely there is a role of acupuncture, and we have treated many patients also. Number one, it stabilizes the blood pressure, so that helps in thrombosis cases, and also to some extent in hemorrhagic cases, where we like to lower the blood pressure. And second is, it is the upper motor neuron lesion, any stroke, cerebral stroke. So in both in upper motor neuron lesion, definitely we can strengthen the lower motor neuron functions activities by the points which supply the concerned muscles. We can do that by using the paravertebral points or Huato Jiaji points that helps to strengthen the lower motor neurons mainly. And for upper motor neuron, there is scalp acupuncture, which is supposed to stimulate the cerebral regions, motor regions. So in that way, we can help the patients. And for preventing purpose, naturally, if there is, we think that there is hypertension, if we can control the hypertension, and that may cause less chances of stroke. We can
True,
help
sir.
in that way.
Great, sir. Thank you, sir. And even some body acupuncture points like GB21 and kidney 1 in case of emergency, we can use. And ischemic stroke, something like SP6 tonification point and P6. And the other condition, Sir said one thing was great, that scalp acupuncture, that plays a major role in that, because in most of the case when we see, the brain has got, the clot or the stroke which start damaging the brain gradually also. So it is one thing, scalp acupuncture plays a major role. So that's a great idea. We can even add those points also. Okay, like there are any other that is emergency points like the techniques and all those things as we have already discussed. So these are the points. And can I have any diagnostic methods of stroke? What are the patterns in TCM? Wind stroke, chi rushing up, blood stasis, yang raising, phlegm damp and phlegm heat, spleen deficiency. This is what we find in the method for stroke. These are the TCM conditions. And in as Sir Dr. Ganthait said, scalp acupuncture, classical also we are having, and we are having area-wise scalp acupuncture, which is it's a modern acupuncture for scalp. They go with the area. So these are the areas where it gets damaged. When you get an MRI, in rehabilitation, you can help those conditions by selecting up the areas also. Post-stroke patients can only be taken care of. Traditional Chinese medicine claim that the symptom of stroke and its sequel responds well to the acupuncture treatment known as wind stroke. Such treatment involves either use body points alone with or without electrical stimulation or combination of body points with scalp acupuncture. Now these are the factors already they have told us, so we'll go forward because we are running short of time. High blood pressure, some people even they do smoking, their addiction, so they smoke due to that condition, obesity, diabetes, lack of physical activity, poor diet, consumption of excess alcohol, and high ratio of blood fats and heart diseases and so on, stress, depression. So now I'd like to discuss one thing. Case one, a lady comes to me with woman is complaining of sudden severe headache, vertigo, and unable to balance the body due to the right side weakness. So I'd like to ask Dr. Rumi Beramji, what will be your protocol, sir?
Normally, the protocol what we use
Yes, sir.
are meridians.
Yes, sir.
So, first and foremost, we like to put up as an integrated medicine.
Yes, sir.
When the allopaths control the patient well,
Yes, sir.
we first add up acupuncture points. Like,
Yes, sir.
for example, the patient is of high blood pressure.
Yes, sir.
We definitely try to control that first.
Yes, sir.
We try to give GV20, which is very, very effective, we have found, and reducing the blood pressure also with the drugs on. And then, depending on the meridian which is involved,
Yes.
I personally go on the meridian aspect.
Fine.
And with the meridian aspect, we see whether the patient has come within how many hours after the problem. If they come within first 15 days, then we find that the results are very good and very fast. If they come about 3 months later, again it goes off.
Fine.
So depending on the type of patient, then we first decide whether the electrical stimulation has to be started or it should be followed later. So when we start any patient which comes, we first start the electrical stimulation on the meridian point which is involved or the nerve roots which are involved. And if we find that the results are good, within 48 to 72 hours we continue it. Otherwise we stop the electrical stimulation, we just give plain acupuncture, and along with that we also put up a lot of autoimmune points. And we have found that adding autoimmune points along with the meridian, the recovery is much, much better than just going one way.
Yes. But this patient has been suffering from diabetes also. Maybe he's taking
You have
drugs
to-
also.
You have to control all medical
Yeah,
things.
after that also it's not controlling, then what shall we do? There is a wind stroke condition and a spleen deficiency. So what can we do with this patient? What should we, and we got an MRI with us, and where we are finding what is the problem, what is this patient suffering from? Dr. Anish, you can put some light on the MRI.
So this is the scan of the patient. You see this black area over there in the front. This is the area where the blood flow has stopped because of diabetes and high blood pressure and probably embolism from the heart. So this patient's blood pressure is very high and the sugars are also high. So we would target the blood pressure to less than 180 millimeter of mercury systolic and sugars to less than 200. And then the acupuncturist will take over.
Yes, great, because actually when the drugs are not working, as Beramji sir said, that we can very well work on acupuncture. It may not help immediately, it takes some time. So you can do the meridian as he said, and the other points, whatever is required you can do, and gradually help this patient. Even Dr. Gantai said, in this condition the scalp acupuncture do help in those conditions. Now what is the treatment okay, this is what is the treatment we already discussed. Does the chi flow, what are the frequent questions? Does the chi flow to the head need regulation? These are the frequent questions they ask. You may hear the acupuncture express this disturbance in terms such as excess wind, fire or water, among other diagnoses. The brain sensing something is amiss triggers the brain areas under distress. These signals are received by opioid receptors which tell the organs to relax and return to normal functioning levels. Is the chi mechanism functioning, Dr. Naik, can I ask that? Whether this chi mechanism do work?
in cases of residual paralysis cases. You see, in USA, I have seen few cases in Maryland Hospital, Maryland Medical Center. So they have a integrative approach with the both, not that only pain clinics are there, and they are having integrative approach of acupuncturists and physicians of modern medicine. But in those hospitals, they have got acupuncturists and neurologists or neurosurgeons. Both the teams are working together.
Yes.
So particularly in cases of chronic cases with the residual paralysis, the improvement becomes very faster with the acupuncture. So along with that, this herbal therapy or massage therapy also they do apply for that. And actually, what I feel that in hospitals, the holistic approach is very much required. Actually, the holistic business, not that the only modern medical persons can treat those things, but there are other complementary medical persons also, they can take part. If both the teams take part, then the patients get the better benefit out of that. So it's nice that we have a good panel discussion. Actually, for the diagnostic point of view, certainly the medical or the modern medical teams is much required, because actually in the age of evidence-based medicine, we cannot just rely on the many of the gems of the ancient Chinese medicine.
Okay, sir, but
So,
TCM says that
yeah.
chi flows, the mind and blood flows.
Yes, okay, sure.
So when we disturb the energy flow
Yes.
occurs, a disturbance of the blood flow occurs.
Yes.
So
sure.
I feel the chi mechanism is
Yeah.
functioning.
Yes.
One more thing to be added, Doctor.
Yeah.
So as far as chi regulation is concerned, there is a one point I think we have forgotten.
Yes.
That is Tai Chong Liver 3.
Yes.
That is supposed to be the main point where we can
have
use to
mentioned that.
yeah,
We
smooth
mentioned
the
in the treatment,
Yes.
and I treat my high BP patients with sometimes
Yeah.
to just lower the BP, and that you saw that one guest of honor.
Yeah.
We use that technically, 4 gates, and it really helped.
yeah. So that is the main chi flow
But
responsible
sometimes, as Dr. Anish said, if the flow is, the BP drops,
Yeah.
and if he's not used to it, that can be even dangerous.
Yeah, that is a disadvantage of using liver 3 because it can overcome certain physiological parameters.
Yes. So are there constitutional factors that need to be addressed for the stroke patient to heal? Can I ask you, Dr. Saman? Sorry? Are there constitutional factors that need to be addressed for the stroke patient to heal? To heal?
Yeah, actually, the constitutionally when we are approaching the patients, we have to select the points according to that particular condition. So this on TCM grounds, we have to select the points after going to the differentiation, signs and symptoms. So that's how we select the points.
Great. So this is the answer, like he's given almost, it depends on that. Even sometimes it depends on the parents also what we get the prenatal chi. And if it's inborn chi is deficient, the individual be more susceptible to the whole range of external and internal factors. We believe that we have any constitutional weakness. We need to take particular care to ensure that there is any other potential cause of disharmony in our life are avoided if possible, and according to that we can treat. So treatment after stroke now. Are the problems with speech and swallowing is there? Dr. Anish, there's any problem with that?
So obviously there can be many problems with the speech and swelling, depends on where the stroke has happened. If the stroke is in the brainstem, then the brainstem centers for lower cranial nerves are involved, then the speech and swallowing will be affected. Obviously if it's a cerebellar stroke, then the speech will be scanning or scattered. If it is a frontal stroke, then the speech will also be impaired. So depends on where the speech area, which portion of the speech area is affected. So speech generally is divided into Wernicke's area and the Broca's area. Wernicke's area is the understanding area, which is located in the temporal lobe, and Broca's area is the motor speech area, which is located in the frontal lobe. So you basically hear, understand from the temporal lobe, and you speak from the frontal lobe. So if the temporal lobe is affected in the stroke, then the patient cannot understand what is being spoken. And if the speech area of Broca's is affected, then the patients can understand what has happened but cannot speak. So depends where the stroke has happened and what kind of impact it creates.
Dr. Gente, there are problems with balance and trunk stability also. Can you put a light on that, that in those conditions after stroke, there will be any conditions, problem with balancing or any trunk stability, and how can we treat in those conditions?
In those conditions where there is balance problem, we can give the cerebellum area in the scalp acupuncture to be more effects on the cerebellum region. And also just body points, this GB20 is very vital point
Yes.
to control the balance problem. Besides the body points, other remaining there in the upper limb, lower limb, but we can give stress on scalp acupuncture and systemic meridian points. GB20 should be the vital points for
Yes, sir.
that.
Fine, sir. And one more thing, like, which is dangerous, sir? Do the stroke is dangerous or hemiparesis after the stroke is dangerous? Like, we know that stroke, the patient will not be able to, he may not be able to balance. He knows that he's got a stroke due to some the other condition. But he's having hemiparesis. In those conditions, that is more simpler than a stroke patient. And how can we treat it with acupuncture?
Stroke, it's decided within 72 hours whether he will survive or not.
But, sir,
Then if
somehow he
he's-
survived, sir.
Then acupuncture is definitely of much help for improvement of the muscles,
Yes.
to develop coordinations. But in my experience, I have seen these finer movements, means finger movements, does not come back fully. Particularly, they will categorically ask, doctor, can I have my bank signature okay? In majority of cases, I have seen they do not get much improvement in these finer movements. But the coarse movements can take the banana, hold it, can take the glass. This is possible.
Yes,
but
sir.
finer movements not possible.
I agree with you, sir. Because I treated one patient in Apollo Hospital, and he was a general manager of Canara Bank, and he had a stroke due to high BP. He was not taking his medicines properly. As you said, it is difficult. It was not possible. We don't get confidence that if we see like that patients. And he was depressed in the, in his ward, whatever it is, it was a room in his. So I went there, and my dad was telling, he's an industrialist, he wanted to have some sanction of loan. So he said, you make him already, he has to sign my papers. And the GM was depressed that he couldn't sign the document. So he said, can't you do anything? I said, this place is not for me. It's not my clinic. It becomes, out of the way. And you won't believe, okay, I said, I'll not do acupuncture, I'll give some acupressure points. I'll just pressure him. And you won't believe, we just made him sit and we signed. He was not able to write A also properly, like maybe a 1-year-old child, he was writing a 2-year-old child. And just I gave pressure on the motor points of the hand, and after some time, his smile came on his face. So it may happen, it's not that it won't happen, but it is very difficult, as Dr. Danta says, it's not easy, it doesn't happen with everybody. Because I have seen even cases where there is paraplegia, and we don't get completely, we get on the leg movements sometimes, not on the hand movements. It's difficult. True. So now when a lower extremity function can the patient walk? Yes. True. I think we got the crowd, very active crowd, they know that. Upper extremity function spasticity. Do anybody have worked on this? Can anybody tell, Dr. Nayak or Dr. Saman? Anybody can put light on this? Yeah. Rumi Beremji wants to tell. Yes. Dr. Rumi Beremji.
Hello. So normally what I found the frustrated, I'll talk from both the point, the allopathic and the acupuncture point. The biggest frustration what happens in allopathy is that most of the people after recovery, they are halfway through.
Yes.
The physiotherapist puts a lot of effort, and the only drawback is spasticity. If I'm wrong, please correct me. So halfway through, maybe after 6 months, 1 year also, you find people are not properly mobile, and the biggest handicap is spasticity. Whereas what I personally feel, acupuncture has the potential to reduce the spasticity.
Yes.
Now, if the patient comes early, the recovery of the patient is practically 80 to 100%.
Yes.
That is the difference I can say. But quite often patients come to you very late, 6 months, 9 months, 1 year. But even there we have seen spasticity can be reduced by more than 50 to 60%, and then the physiotherapist is very happy to take over
Okay.
for further recovery. So I think acupuncture has a very important role in paralysis by treating spasticity.
Yes, sir, it's true. Actually, I've treated leukodystrophy, was where the spasticity of both the limbs were there and all the upper and lower. And the patient had come to me, one neurologist has said me that this child won't survive beyond 1 month. And for which we had done treatment, and actually when somebody comes and says the child will die in a month, any doctor, any acupuncturist will not take up the case. So I was with fear, okay, we'll take it, we'll see, we'll do a 10 session and see if there is any improvement, we'll go ahead. I did the scalp acupuncture as Dr. Ganta had said, and to my surprise, the patient had relief in just 3 sessions. Slowly his motor movements started improving, and that made me more confident. Today the child is healthy, and all the neurologist department is surprised what happened to this child. It's walking also now.
And Dr. Rajesh,
Yes,
for this spasticity problem,
yes,
in my opinion,
yes, sir.
the general principle should be to select points from the extensor surface of the body or
Sir, we
ion
use
channels.
that also. Sir, we use that also. But
And-
now the child is only 1 year and 3 months.
Oh.
And he was a normal child and it was sudden progressive. So we have used a special technique like press needles. That is very simple. And we use those techniques. I think if I would have presented that paper, a short of, lot of today this type papers. So I cut short that leukodystrophy topic. So otherwise we use that one also, sir. Body acupuncture.
I tell you the science behind that because our pyramidal tract develops almost at the end of 1 year of life. And before that, the man lives in uterine life. The flexor tone is more, as if a man is mother's womb. All muscles are in flexor tone. After development of pyramidal tract, which takes about 1 year,
Yes.
we get the extensor tones.
Yes.
So whenever there is pyramidal tract lesion, means UMN type,
Yes.
in adult hemiparesis,
Yes.
then the upper motor control goes. So the man remains mainly in the flexor tone. So all these flexor tones. So now our aim, scientific aim should be to strengthen the extensor group of muscles.
Yes.
So the spasticity will be less.
Yes.
So that should be the general principle.
Yes, sir, we did like that really. That's why, to my surprise, because see, it was the degeneration was very faster. And this happened with the fever, febrile condition, and the child was admitted, and I knew that this child will get epilepsy. So we had, not left the neurologist. We had a neurologist with us, so we didn't have the problem. Dr. Anish was with us. So finally we'll conclude it because we're running short of time. Let us have one break of tea. So as practitioners of acupuncture, we can and should think of ourselves as well able to help patients who have suffered stroke, whether we encounter them at recovery, rehabilitation, or chronic phases. We can also help to prevent primary and secondary stroke. It is my opinion that this discussion will show practitioners how greatly they help the patients using primary diagnostic and treatment techniques they already know. Acupuncturists who wish to specialize in treating stroke and other neurological disorders will certainly wish to pursue further studies. So thank you.
That was indeed a very informative panel discussion. Thank you, doctors.
Any questions you want to ask, but we are running short of time. Only one question. You can ask any of our panelists. Already they've answered all the questions because now it's time for tea. Yes.